Welcome back to the channel. Today we are discussing Tylenol, a household name for pain relief. Its generic name is Acetaminophen in the US and paracetamol internationally. It is one of the most commonly used over the counter or OTC medications worldwide and is listed on the WHO's or WHO's essential medicine lists for its importance in basic healthcare. In this tutorial, we will explore how it works, its pharmacokinetics, clinical uses, side effects, and safety considerations. Let's get started. So, acetaminophen's mechanism is distinct from NSAIDs. It weakly inhibits COX-1 and COX-2 enzymes, primarily in the central nervous system. By reducing prostaglandin synthesis in the brain, it effectively alleviates pain or analgesic effect and reduces fever or antipyretic effect. However, it has minimal anti-inflammatory properties because it does not significantly inhibit COX enzymes in the peripheral tissues. Acetaminophen is quickly absorbed from the small intestine with an onset of action of about 30 to 60 minutes for oral forms. It is widely distributed in the body and can cross the blood brain barrier, making it effective for CNS related pain relief. The liver metabolizes acetaminophen mainly through glucuronidation and sulfation pathways. A small fraction is converted into a toxic metabolite, N-acetyl para benzoquinone imine or NAPQI via the cytochrome P2E1 enzyme. Under normal circumstances, NAPQI is neutralized by glutathione. But excessive doses can overwhelm this system, leading to liver damage. It is primarily excreted via the urine, with less than 5% excreted unchanged. For adults, the usual dose ranges from 325 to 1000 mg depending on the formulation, with a maximum daily dose of 4 grams. For chronic users, this limit is reduced to 3 grams to minimize the risk of liver toxicity. In pediatric patients, dosing is weight based at 10 to 15 mg per kg every 4 to 6 hours, not exceeding 75 mg per kg per day. It's crucial to adjust the dosage in patients with liver impairments and to avoid it in cases of severe alcoholic liver diseases due to the increased risk of hepatotoxicity. Acetaminophen is available in various formulations to suit different needs, including tablets, liquid suspensions, extended release caplets, rectal suppositories, and intravenous injections. This variety allows for flexible use in different patient populations and clinical scenarios. The most common brand names include Tylenol in the US and Panadol globally. Acetaminophen is commonly used for the relief of mild to moderate pain, such as headaches, menstrual cramps, and osteoarthritis. It's also a go-to medication for reducing fever in cases of infections or post-vaccinations. It is often preferred for patients with peptic ulcers and aspirin sensitivity because it does not cause gastrointestinal irritations. Acetaminophen is generally well tolerated but can cause side effects like nausea, stomach pain, and rashes. The most severe risk is hepatotoxicity, especially with overdose or in patients consuming alcohol. Early signs of overdose include nausea, vomiting, and sweating, followed by signs of liver damage such as jaundice and confusion. Immediate medical interventions is crucial in cases of suspected overdose. Acetaminophen's use with alcohol significantly raises the risk of liver toxicity. It may also interact with warfarin, increasing the risk of bleeding. Drugs like carbamazepine and rifampin, which induces liver enzymes, can reduce the effectiveness of acetaminophen. High fat meals may slow its absorption, but this usually has minimal significant clinical significance. Now let's dive deeper into the use of acetaminophen during pregnancy and lactation, which is very much important. So during the pregnancy, acetaminophen is classified as category B drug by the FDA, meaning that is generally considered safe when used as directed during pregnancy. It is often recommended for managing mild pain and fever, as does not carry the same risk as NSAIDs like aspirin or ibuprofen, which can affect the fetal circulations. However, there are important considerations. Prolonged or high dose use during pregnancy may be associated with potential developmental issues, including a slight increase in the risk of behavioral problems such as ADHD. Additionally, cases of fetal liver damages have been reported following maternal overdose, which highlights the importance of adhering to the recommended dosage. To ensure safety, acetaminophen should be used in short term, low doses, and it is always best to consult a healthcare provider, especially if pain persists or frequent use is necessary during pregnancy. Now, lactation. For breastfeeding mothers, acetaminophen is considered safe. The transfer of acetaminophen into breast milk is minimal, with less than 1% of the maternal dose reaching the infant. This low level is unlikely to cause adverse effect in most nursing infants. However, it's wise to monitor the infant for any unusual symptoms such as excessive sleepiness or poor feeding, although these side effects are rare. Given its favorable safety profile, acetaminophen is often the preferred choice for pain and fever relief in nursing mothers. In conclusion, while acetaminophen is generally safe for use during both pregnancy and lactation, the key is to use it judicially and consult healthcare professionals if there is any concern about dosage or prolonged use. This careful approach helps minimize risk while providing effective symptomatic relief for the mother. Now let's wrap up our comprehensive guide to Tylenol or acetaminophen. To help you retain the key points, here is a quick summary. Effective for pain and fever, acetaminophen is widely used and effective for managing mild to moderate pain and reducing fever. Next point is maximum dose. For adults, the maximum safe dosage is 4 grams per day. Exceeding this limit can lead to liver damage. Next point is liver health. So patients with liver disease or those who consume alcohol regularly should use acetaminophen with caution to avoid hepatotoxicity. Okay. Multiple forms. It comes in various formulations such as tablets, liquid suspension, suppositories, and intravenous injections, making it versatile for different patient needs. Next point is pregnancy safety. Okay, generally considered safe during pregnancy, but it's always best to consult a healthcare provider, especially with prolonged use. Next, check labels. Okay, many over the counter medications contain acetaminophen, so be vigilant to avoid accidental overdose. Interactions. Be aware of drug interactions, particularly with warfarin and alcohol, which can cause or increase the risk of bleeding or liver damage. Next point is overdose risk. Early signs of overdose include nausea and vomiting. Liver damage may develop later, so prompt medication attention is needed or crucial. Duration of use. Avoid prolonged use without medical advice. For chronic pain, consult a healthcare provider to explore safer alternatives. Seek help if you have any concern about using acetaminophen or experience unusual symptoms. Always consult a healthcare professional. Finish up, let's cover some common questions we get about acetaminophen. So here are some common answers of the top frequently asked questions about acetaminophen that we often receive from our viewers. Can I take Tylenol with ibuprofen? Yes. Acetaminophen and ibuprofen can be taken together or alternated because they have different mechanisms of actions. However, always follow dosage guidelines and consult a healthcare provider. How long does it take for acetaminophen to work? It typically takes about 30 to 60 minutes to start relieving pain or reducing fever. What should I do if I accidentally take too much? If you exceed the recommended dose, especially over 4 grams per day, seek medical attention immediately. Early interventions is critical to prevent liver damage. Is it safe to take Tylenol daily or for chronic pain? Long-term daily use of acetaminophen should only be under medical supervision, as it increases the risk of liver damage, especially at higher doses. Can I take acetaminophen while pregnant? Acetaminophen is generally considered safe during pregnancy but should be used under a healthcare provider's guideline and particularly for prolonged use. What are the symptoms of an acetaminophen overdose? Initial symptoms may include nausea, vomiting, and abdominal pain. Severe liver damage may develop later, which can be life threatening without treatment. Does acetaminophen interact with alcohol? Yes, combining acetaminophen with alcohol significantly increases the risk of liver damages. It's best to avoid alcohol when taking this medication. Can children take acetaminophen? Yes, it is commonly used in children for pain and relief fever. However, dosing is based on the child's weight, so always follow the guidelines on the packaging or consult a pediatrician. How does acetaminophen differ from NSAIDs like ibuprofen? Acetaminophen is primarily an analgesic and antipyretic with minimal anti-inflammatory properties or effects, while NSAIDs like ibuprofen reduces inflammation in addition to relieving pain and fever. What's the difference between Tylenol and generic acetaminophen? The main difference is the brand name. Both contain the same active ingredient, acetaminophen, and work similarly. Generic versions are typically more effective but equally effective. Thank you for watching our detailed video or guide on Tylenol or acetaminophen. I hope this answers all your queries. If you have any more questions, feel free to leave them in the comments below. Don't forget to like, share, and subscribe for more educational content. See you in the next video.